is Dr. Neuhaus. I'm excited to be here today and talk to you about a new treatment that we have in the office for nail fungus. In the past, nail fungus has been one of the stubborn things that I really didn't like treating in the office because the options are very limited, and that is you can take pills or you can use some topical paint-on medication. Truth of the matter is neither one of them worked really well. Neither was a really good option. And nail fungus, studies show that it's affecting somewhere between 10 and 15% of the population, depending on what you read. Well, that's a lot of people. I mean, we're talking 30, 40 million people in our country walking around with discolored, painful, thick, deformed toenails, and really not a lot of good treatment options. In the past, we had to use pills. That was the most effective. Studies show maybe 60 to 70% of people will get decent results with the pills. However, when you do blood work, the pills can have side effects, goes through your liver. We worry about liver problems, and a lot of people just don't want to take the chance with that. There's interaction with other medications, and then it only works maybe 2/3 of the time. Then you get the paint-on treatments. You can go to the drugstore, and I use some in my office. I use Formula 3 in my office, which is by far and away the best option that I've found thus far, but that's less than 50% successful. And there's some studies that say it's more in the neighborhood of 10 to 20% successful using any of the topical treatments. So those are not really good options. And then we have this new option, which is a laser. Over the past several years, people have been working on developing lasers to try to treat toenail fungus. And there's been some different lasers that have come out. They've come and gone. I've kind of sat by the wayside waiting for the right one to jump in and say, hey, this is it. I think I finally found it. It's called the Q-Clear laser. It is very easy to do. It's quick to do in the office. It's not going to work on all nails that are deformed and fungal. You have to file the nail down. Sometimes with really thick, deformed nails, those will need to be removed before we apply the laser because the light just won't get through the nail. So we treat the nail bed, we treat where the nail grows. The light goes through and actually kills the fungus right there, kind of vaporizes it. But the nail's not going to look any different until it grows out. And that's been the problem all along with nail fungus is people want that quick fix. They say, hey, it's March. I want my nails to look good for the summer, going to the beach in May. Even with the laser, that's not going to happen. The nails still take 6 to 12 months to grow out. So you got to wait. You got to let the nail grow out. But this new laser is very promising. Early studies are coming out. We really don't have good statistics, to be honest, on the success rate. But I would expect that from the people that I've talked to that have been doing it for the last year or two, they're seeing 75–80% success using this new laser. It's a treatment, again, that's very easy to do in the office. It may require more than one application. There are people out there saying that it's only going to take one treatment and you're done, and that may very well turn out to be the case. I think we got to wait for studies to show us how that's going to turn out. It's a brand new machine. Not a lot of people using it around the country. It's been approved by the FDA for treatment of nail fungus. There are studies that demonstrate that it works, and I think this holds great promise for treatment in nail fungus. So I'm very excited. I hope you can check out our website that we've made to explain a little bit more about the laser. Come on into the office and let's take a look and see what we can do to help you get rid of this toenail fungus problem. Again, it's Dr. Neuhaus. Thanks for using our website and checking out our videos.